How is AI reshaping the way doctors and patients navigate medicine? Welcome to WarDocs, where we dive into the cutting-edge world of AI in medicine with subject matter expert Dr. Hassan Tetteh. From groundbreaking applications to ethical dilemmas, we explore how AI is transforming both civilian and federal healthcare, tackling unique challenges like those in the military health system and the VA, and empowering patients in ways we never thought possible. Buckle up for a fascinating look at the future of healthcare. For further information about Dr. Tetteh and our previous guests, visit our website at wardocspodcast.com. Be sure to follow WarDocs on your preferred podcast platform and subscribe to our WarDocs YouTube channel. I'm your host, Dr. Doug Soderdahl, retired Army urologist.
Welcome to WarDocs, the military medicine podcast. This show brings you a first-hand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, WarDocs has you covered.
On this episode of WarDocs, we welcome retired Navy Captain, cardiothoracic surgeon, Dr. Hassan Tetteh. Dr. Tetteh is an expert in clinical informatics, an adjunct faculty member at the Johns Hopkins Carey Business School Center for Digital Health and Artificial Intelligence, and the author of the book Smarter Healthcare with AI. Today, we're going to talk about the most important AI topics, questions, and concerns for healthcare professionals. Hassan, welcome back to WarDocs.
Thank you for having me, Doug. It's an honor to be here, and I'm super excited about talking about a topic I'm very passionate about, and looking forward to the discussion.
All right, well, why don't we start with the big picture? Can you provide just a brief overview of how AI is currently being utilized in healthcare and share maybe what you consider the most promising applications over the next year or two?
And let me just step back maybe at the 30,000 foot view, because it's very important, especially for this audience, to understand, in my opinion, where I think we are with this great technology. If you think about, the arms race that many of us have studied about and think about nuclear power and things like that, many decades ago, it was never lost. And I think always something that we have been aware of in the military, that our military power and our innovation and our ability to do what we've done in the world has really been a consequence of the result of World War II. And the result being that, we won and we were able to unleash a very powerful technology in the nuclear bomb. If you think about AI now, it's that AI arms race. And so at a very high 30,000 foot view, I think when we think about healthcare and AI, we should really think about the macro environment and the geopolitical context of where we are. And certainly many administrations now, including this current administration, have really put into place a number of initiatives to really unleash AI technology, innovation, and really try to secure our place in the world when it comes to AI and our superiority in that domain. And it's through the national security lens that I came to be intimately involved in artificial intelligence. It was really my time that I spent at the National War College studying AI and then working on research to meld both AI and military medicine. That journey, but for me, was really what brought me to sort of the understanding that I have about AI, how I look at it in the context of military medicine, and how I look at it in the context of a sort of larger picture of where we are. So the state of AI in healthcare, where are we and what's next? I think AI has now become this invisible teammate in every ward. Certainly when you think about ChatGPT and the large language models sort of being unleashed into the population or to the public space and domain just a couple years ago, it really, for the first time, I think, put AI in the hands of the everyday user and made it actually tangible for the first time. Because before that, AI was something that was very amorphous, if you will, unless you were a computer scientist or you were really dealing in computers and had a lot of working knowledge of AI in and of itself. You really were shielded from working with it directly, unlike you are now. And I think that's really made a big difference. So you think about, here in healthcare, we have it helping us to write notes, flagging silent sepsis, even, staring and sort of keeping us sort of on the right path in the operating room with respect to robots. So I think in the next 24 months, you'll see AI, in my opinion, graduate from this assistant to a co-pilot and sort of help really deliver real-time decision support at the bedside in a way that probably has been unimaginable in the past, and help to really realize this great potential that we thought we all were going to enjoy and benefit from with the digitization of health records.
Now, can you highlight any recent AI developments or breakthroughs that you think are just crazy important, significantly impacting healthcare? What should our audience be aware of about what's going to happen in the next couple months or even, half a year or a year?
I think we have on the horizon some pretty important breakthroughs. You think about just my specialty, and I'm proud to know the surgeon that was responsible for this in many ways, because he trained me in University of Minnesota, where I did my fellowship. The first fully robotic heart transplant was completed in Houston. And that sounds like, okay, well, we've been doing robotic surgery, but now if robotics are sort of being used to push the envelope in what we can do. And right around, this same sort of past few months, we saw that researchers from Hopkins did an fully robotic autonomous cholecystectomy on a cadaveric pig, and they did that on several specimens, and that it seems so fantastical now, especially if you think 10 years ago, if you would have said, hey, in a few years they're going to be doing a fully autonomous resection of a gallbladder in a pig, mind you, but nonetheless, that definitely gives you a pathway for potential applications in humans. When you think about all of the breakthroughs that DARPA has been pioneering, from replacement blood products, the ability for us to now use AI to develop protein foldings and architecture in a way that we never were able to do before without it requiring tons and tons of work and lots of time, that's now being possible. So the breakthroughs that could come from that are unimaginable. And the FDA now has over 1,100 cleared AI devices, and dozens of them are being added every month. And so you can just imagine, Doug, that the pace at which we're going to see breakthroughs coming are just going to be a lot more rapid and a lot more, I think, impactful, especially as adoption and integration into healthcare workflows starts to become more commonplace. Right now, that's not necessarily the case, but as that becomes more commonplace, I think that's going to be where you really start to see the transformation of healthcare from a workforce workflow type of paradigm.
Now, would you say that, resistance is futile? There's some, the gray hair docs out there. It's like, there's no way I'm going to bring AI into my practice. But it seems like it's inevitable.
Yeah, well, resistance is futile is certainly one way to characterize that. But I will say that we need not look very far to see what happens when in healthcare one does not, you know, adopt a posture of continuous learning and improvement. And I'll take my specialty again and use that as an example, because that's where I know best. And I think back to, your question being something that reminds me always of a caricature of one of my near and dear surgical mentors, who at the time was just a giant of a surgeon. He had worked and had leadership in almost every domain of surgery in the space where I sort of trained, and that was in Brooklyn. And in New York City, he had done almost everything. He had, like I said, had been a leader at almost every major institution. Was a great surgeon. Was a great individual. I learned a lot from him. But he would be what I characterize as sort of an old school surgeon. And we would do at the time open cholecystectomies, open gallbladder resections. And Doug, for those of us that know what that is, and for those of who don't know, that's removing the gallbladder. Now, there was a time when we did that with a pretty, large incision called a chevron incision that was right underneath the right costal margin. And that was a very painful incision. You had to go through all of the abdominal muscles, and you had to, use very large retractors to sort of retract the liver up, and lots of work in a very deep hole. And then came along this laparoscopic procedure. And I'm dating myself here, but you're talking about the early 2000s. And at that time, those of us that were young, very eager residents were really embracing this technology, because we could see that you could put in a port, you could put in a camera, you could insufflate the abdomen, and in a matter of minutes, this gallbladder, which would be so hard to see when the traditional open procedure, was now visualized, and visualized in such a way that you could see the anatomy, you could identify structures, and you could very quickly get a dissection going, isolate the cystic duct and isolate the artery, put some clips in, make a couple of snips with the scissors, and then take this gallbladder out with a bag, and you'd be done in a few minutes. And as residents, we were all, timing ourselves to see how fast we could get it done, much faster than doing it the open way. And I would tell my senior colleague, I'd say, "Hey, sir, there's a faster way to do this, and we can do the laparoscope." And you know what he would tell me, Doug? He'd say, "Nah, there's no way. I don't believe in that stuff. That laparoscopic stuff was developed and invented by OBGYN doctors. There's no way we'll use that."
Right. It's going to be a flash in the pan. It's going
Flash in the
away.
pan. It's not going to last. There's no way. And I don't need to tell you how this story ended. And for those that may have been, or may ascribe or consider themselves the camp of the old school surgeon that I'm referring to, if you think that you're that kind of person, and you may think, well, AI is just a fad, I'll tell you this. You know what happened, Doug? It wasn't necessary for my surgeon to change his practice, insofar as his patients did it for him.
Right.
And what I mean by that is, at that time, we were still admitting some of these patients overnight. So the laparoscopic cholecystectomy would be right next to, in the same room, recovering, with the patient that had the open cholecystectomy. And you know what patients do? They talk. Well,
Right.
hey, what procedure did you have? Oh, I had my gallbladder removed. And you'd see one patient that was in tremendous discomfort and pain, couldn't walk, was writhing there on the bed, and another one that was up and about and moving around like, nothing really happened. And as they got to talking, they realized that this was the same procedure, removing the gallbladder, but two entirely different techniques. They gave, completely different outcomes in terms of recovery. And I don't need to tell you how that ended, right? Well, over time, what happens is those patients will start, making decisions with their feet and marching over to the surgeons that are embracing technologies that give them, as good, if not better outcomes, and certainly with less morbidity and potential mortality and discomfort. We are in that same kind of context now. Of course, AI is a lot more ubiquitous than one small technology like the laparoscope. But if you think about robotics, you think about autonomous robotics now being a possibility, certainly in research models. I think that there is a time coming in the very near future where, if you are those kinds of surgeons that are going to be resistant to this, you may find that the decision will be made for you by your patients and by others, because there will be an adoption of a different and a better way, ideally, largely driven and fueled by AI.
So we're WarDocs, the military medicine podcast. How about AI and military medicine? Are there any unique applications or challenges for AI in our field, perhaps in combat zones, remote settings, for triage, telemedicine, damage control, resuscitation? What stands out to you, military specific?
My answer is colored by my experience. My experience was largely coming from what I got to do and had the honor and privilege of doing while I was in uniform, and certainly in the last few years of my time, both in my CMIO role as the Chief Medical Informatics Officer for the Navy, but also, and probably more importantly, is my experience with being the Warfighter Health Mission Chief at the Joint Artificial Intelligence Center when that was organized and coming into maturity. So, we have always been thinking, anyone in the WarDocs community, whether you are on the logistician side, if you're on the actual, combat casualty side, and anywhere in between, you think about what it is that we do, take care of the wounded, ill, and injured in a war space, in the combat zone. And we often have to deploy very critical assets into dangerous places and put them in harm's way, which could potentially be mission critical if those individuals that are there to help those that have been ill, injured, and wounded get hurt themselves. Now you've actually compromised a critical asset like a surgeon. So this concept of autonomous triage and damage control resuscitation, especially in austere, at the edge, domains and environments, has always been sort of the holy grail of what we've always tried to do. If you look at many of the DARPA challenges and many of them that I've helped support, a lot of that has been, how do we get care to those that need it in austere environments and do it in such a way that we can actually deliver very effective care, but actually not have to necessarily put very valuable and sometimes critical assets in harm's way and compromise not only their health and safety, but the mission success overall. AI is very ripe for those unique frontline use cases. Autonomous triage, for example, as I mentioned, damage control resuscitation. If you imagine, your buddy or a medic or a corpsman, someone who has experience and has background in taking care of individuals, but may need a little bit of extra assistance to take care of something a little bit more complicated, or to help triage a number of wounded at the same time. Can you imagine, Doug, if they were able to sort of tap into a resource, whether that be through virtual, a virtual platform, or if they could actually, put on glasses or something that could help someone on another side of the world, help them go through and walk through steps that could potentially be life-saving that they may not necessarily have, access to otherwise. So I think those are the kinds of things that we'll start to see. And then, aside from that, think about these really, really sophisticated smart wearables now that we all are very accustomed to using right now. I have my watch that has, tracking all kinds of things from sleep to heart rate and blood pressure, respiratory rate, O2 saturations. Can you imagine having that on, our warfighters as they are not only working through the mission and unfortunately potentially getting injured or wounded? Now that information can now be synthesized to give us a little bit of a better picture of what are we really facing and dealing with when we get the wounded that come into our FOBs, into our STPs, and so forth. And so I think there's going to be a lot of opportunities for AI applications in military medicine, notwithstanding just other things. One of the projects that we had worked on when I was at the Jake was, deploying blood, for example, using drones. Again, seems very, obvious, but it could be potentially life-saving if you could deliver a life-saving asset like a therapy of blood to some place where you otherwise would have to remove, extract that patient and bring them to a facility where you could, administer that could be a game changer. So I think this future vision of AI in military medicine is going to be ripe with many, many use cases that we're only beginning to scratch the surface on. And I think it's an exciting time. And I think the military is going to continue to lead in pushing the envelope just because we always have. When you think about the historical context of vaccine development, blood banking itself, trauma and resuscitation, we in the military, and certainly those of us that, really define ourselves as war docs, know that in austere environments, we've had to be innovative. And I think now what we have at our disposal is a very exciting tool and technology in AI that can help us push those boundaries even further.
Now, in your book, there's an interesting chapter about transitioning from active duty to the VA and how that process can be confusing and how AI can help with that. And I don't want to talk about that because I want people to read your book, and because I think it's a great chapter. But we talked about military medicine. How about the VA? Where could artificial intelligence maybe help in some of the things that are big problems in the VA? Suicide, mental health, TBI. How does AI play into that?
I'm embarrassed to say that my transition from the military into the civilian sector was not very smooth, albeit it should have been. Thinking that I'm a senior officer, retired from the military after many years, obviously worked in the medical space. But suffice to say, the story is definitely in the book, and I would hope and encourage the readers and the audience to look at that story. But to answer your question, I think we have a wide use of applications in the VA population as well. Kind of going back again, taking a step back to that experience, which was very defining with the Warfighter Health Mission and Joint Artificial Intelligence Center. Our colleagues made a very deliberate strategic choice to partner with the VA very early on because we recognized that we were all taking care of the same individuals, those that have served, right? Obviously, they're serving in active duty when they're in sort of the military health system, but once they transition to the VA, they've also served. And oh, by the way, many of the things that they were exposed to as active duty servicemen and women are giving them potential health problems and leading to some issues when they're in the VA system. And we are documenting all of this information through the electronic health record. And so we realize that we have in this unique population, those active duty and those that are retired and transitioned into the VA, this very unique population with digitized and digital data. And we recognize that there are a lot of challenges that are unique to the military population and in the VA in particular, exposures to harmful agents. We've come to realize now that burn pits are actually very hazardous and can lead to numerous health conditions that may be realized later in life. Well, with that documentation and with AI, you can help to sort of synthesize who may be at higher risk. That's just one example, the cancers, etc. We also recognize that behavioral health issues and suicide in particular was a great challenge. One of the projects and initiatives that we had worked on at the Jake was helping to use AI, particularly natural language processing, NLP, to help us determine who could be at risk for suicide prevention and destructive behaviors or harmful behaviors. And we made a lot of headway with that. Nowadays, there are chatbots out there that have proven to be very effective in helping with behavioral health issues, not only with hoping to avert harmful behaviors or destructive behaviors, but also helping people with the epidemic and pandemic of loneliness and having a resource to express and share issues that would otherwise go either unnoticed or unaddressed. And then, of course, we have all of the opportunities to have registries and a myriad of information that sort of can be correlated, can be synthesized, and could be used to effectively address some of the very unique conditions that VA population patients will be, manifesting throughout their life. And I think that, with AI, you have this very unique opportunity to marry all of this information and give the clinicians and the care teams a lot more insight in a way that they didn't have before. And again, dating myself and certainly probably some of the people in the audience, if you think about the very difficult but very practical issues that many people in the military have had to deal with, transitioning from the active duty side to the VA with paper records and holding this big paper file and having to sift through all of that and get a rating for disability. I mean, we now have the opportunity to make that whole process a lot less challenging and ideally better for the veteran, not only for their life and their longevity, but also just for people that are coming into the military, knowing and having the assurance of saying, hey, listen, if anything happens to me, I know because we have these tools in place that I'll be taken care of. And just think about how much more of an effective warfighter that makes that individual. When they have that assurance of knowing no matter what happens, I'll be taken care of. And I'm not only going to be taken care of, but I'm going to be taken care of by an organization and by a system and enterprise that's using and leveraging the best of the best technology in AI.
So I think nobody would disagree that AI holds incredible potential. But you see a lot of people saying, hey, pump the brakes because there's some ethical concerns. What would you say are the biggest ethical problems in healthcare, say around privacy, data quality, accountability, and how can we address them to assure that AI is used responsibly?
I'm going to answer it in a bit of a unique way, and not to sidestep the question, but again, go back to what I said in the beginning about this era, if you will, or this time that we're living in, where AI is our new arms race, and that's for the global context. And yes, having regulations and having guardrails in place is absolutely necessary, but we have to do that very strategically because you don't want to do that at the expense of stifling innovation and having us lose our foothold and right now our leadership in this new arms race, so to speak. So I'm going to characterize what I say next by making sure that that context is in place. We can't lose, in my opinion, when it comes to AI leadership in the world. Yes, we have to lead in the technology, but we also have to lead in its regulation and its exportation to other places. And in that comes a very grave responsibility with ensuring that there's data integrity because a lot of the models that are built that we are using is in fact built on data. So if the data is not good, just like anything else, input in, if it's bad, it'll have bad outputs. So I think, again, the military in particular in the United States is in a very unique position because many of these systems, many of these data sets were all created by, those companies that are here based in the United States. And if you think about how these models are developed, they're based on the corpus of knowledge and digitized data that we've now amassed over all of these decades. Our responsibility is to ensure that we eliminate as much as possible corrupt data, that we exclude bad data so that we have good and robust models. When we were at the Jake, one of the things that we helped to work on, which became the framework for the DoD's ethical use of AI, was the work that we were doing. We met with many of our allies from overseas. We met with many of the departments throughout the government to come up with some standards. And they were, if you will, sort of a roadmap of sort of AI rules of engagement that we used as guidelines. Now, even though we had those guidelines, we were able to still push the envelope and still innovate and still go ahead and go forward and do a lot of great things that I believe we did in a responsible way. Would we make mistakes? Of course we would, but that's what happens in innovation. I think that the short answer to this is not the time to put the brakes on anything, especially when it comes to AI. And that may be a bold statement to say that, but I think if you think about the consequences and the implications of us not being in charge or being in the lead, and certainly playing a leadership role in AI's development and maturity in the coming years, I think it places us and our national security at risk in a way that's far greater than what would come of, I don't know, some rogue innovation that may potentially cause harm, because I think the stakes are too high right now for us to not innovate and not to be bold in terms of how we are advancing this technology.
Now, the military health system and the VA system seem like a pretty good place where there's ripe data sets. And even if people don't want to share data, there's kind of an overarching chain of command that can make them share data. Are there any problems with proprietary data that, let's say, a Mass General doesn't want to share their data, Hopkins doesn't want to share their data, and they're making their own systems on their own? Or are we able to have AI look at the entire healthcare system and learn from, like you said, cold, good data?
I think the short answer is because we live in a capitalistic country, I won't be naive or Pollyannish to think that people won't guard their data, especially if they perceive that there's value in data. And right now, data is valuable. And so, you're going to have, in my opinion, you're going to have domains and you're going to have echelons of organizations that will hoard and hold their data, and that's probably their prerogative. In the military, I think we have unique opportunities to not only safeguard our members and the privacy of our service members' data, but we can do so in such a way that we still, with respect to their privacy, help to advance the technology further. I'll give you an example. One of the insights that I share in the book is about the Joint Pathology Center, for example, where we have data that we've collected in the form of slides, pathology slides, over a century, millions and millions of these specimens, right? And if anyone recalls their time in the military and certainly even in the civilian sector, whenever you had one of these unusual, very unique, esoteric kind of diseases that you couldn't characterize, on the microscope, even with the best of your pathologists in your institution, what would you do? You'd send it to the military because
AFIP, call them.
yeah, right, exactly, right. Call them up because they if we haven't seen it, they probably have seen it. Now, one of the projects that we had was de-identifying that data, digitizing that data, and then having that data serve as a training source for models. And then using computer vision, we equipped microscopes to detect cancers, certain cancers. Now, that to me is a great use of the data. Yeah, proprietary, sure, because it's the military. But think about the goodwill, not to mention the value that now affords other healthcare organizations to learn from in a way that doesn't violate the safety, the privacy of the service member, but can use the resource to create, in this case, a diagnostic tool that was actually very helpful in helping to determine and sort of characterize certain cancers. That's just one example, Doug. You think about our radiologic asset, all of the hundreds of millions of plain films, CT scans, MRI images that we have on our service members. And if you think about, the ability to de-identify that, absolutely, that could be another rich data set that could be used not only to advance military medicine, but to advance all of healthcare. So I think there are examples where, again, the military can take lead in being sort of the vanguard for showing how the art of the possible can be leveraged in a way that helps not only the military but also helps the civilian sector. And we have a track record of doing that, and I believe that this is one of those times where, with the right leadership and with the right vision, the military can really do great things, in this next century, so to speak, of opportunity within healthcare. The subtitle of my book is Harnessing Military Medicine to Revolutionize Healthcare for Everyone Everywhere. It was very deliberate because I spent a lot of time thinking critically about how the military has led in so many ways to bring about the advanced, very unique, and very powerful healthcare system that we do have that can take care of patients in a way that we were never able to do, certainly a century ago and even decades ago.
So your examples are a great segue to my next question. And we have pre-medical folks and medical students that are listening to the podcast and they haven't specialized and they still get a chance to decide, hey, what specialty do I want to choose to, go into? And it seems that some specialties seem more ripe for AI integration than others. Which ones do you think will see the most significant impact? You mentioned pathology, radiology. And are there any where AI might eventually replace human professionals entirely?
Yeah, very controversial question. So this word of replacement is been thrown around quite a bit. What I'll say to that is, will AI and a robot replace a doctor? Probably, maybe someday it's possible. You have no doubt, seen things like Star Trek where, there's the tricorder and it could just you scan it over someone and gives you the diagnosis. And I think about my specialty in cardiac surgery where there was a time when we were doing cabbages that was very routine. Stents weren't really thought of or heard of. And I remember some of my senior colleagues in cardiac surgery saying, "Oh, these cardiologists and the stents, they're never going to work. They're just not going to be as good as our bypasses." Well, you see how that's worked out, right? The volume of cabbages have gone down quite a bit, and we're now doing valves through percutaneous ways, intravascularly. It's something that many people in my discipline thought would never happen. And it's one of the reasons why I think I went into heart transplant, because I was like, well, it's going to be a while before cardiologists can replace a heart. I think we still need
Sure.
surgeons for that. But seriously, Doug, the questions you ask is a really good thing, and I think people need to understand, especially for those that are of the younger generation and thinking about this great discipline and profession of healthcare that they're embarking on, that medicine and healthcare, especially in the years to come, is going to constantly evolve and change and shift. So radiology, pathology, critical care, anesthesia, any of these specialties that rely on a lot of data analysis, synthesizing the information to gain insights, they're absolutely going to be changed by AI. Hopefully in a very unique and a better way, and improve the outcomes for patients, that are exposed to any of those disciplines. As for the practitioners in those professions, should they be worried that their job is going to be taken away or it's going to be supplanted? Probably, but they should also be aware that whatever happens, their job is going to evolve. And unless they are of the right mindset, which in my opinion should be remain curious, be very receptive to change, adopt and adapt to the change, but also lead in the change. Because many of these technologies are not created by physicians. Many of them are informed by physicians, but they're not created by us. And because we have a domain expertise, we are an invaluable asset and resource to the technologists. Trust me, I know, because at the Jake, our team worked side by side with some of the most brilliant AI engineers, data scientists you could ever hope to ever be involved with. And they were thirsty for our perspective because they wanted to understand how their technology, how their solutions could be applied in an effective manner in the domain spaces that we work in. And I'll just give you another example. So I finished my general surgery training in 2003. I finished cardiac surgery training in 2008 after spending some time as a general surgeon. At that time, the specialty that I'm now board certified in, another subspecialty that I'm board certified, clinical informatics, didn't even exist. So when I just think about that, so for your students and for those of you that are sort of younger in your profession, think about that. You are graduating and will graduate at a time where something you ultimately do doesn't even exist right now. So if you would have stopped me in 2003 and say, hey, do you think in a few years you're going to be board certified in another specialty called informatics? I would have been like, what is that? What are you talking about? So my point is, how did that happen for me? It happened because I've always maintained that healthcare is one of these disciplines where you always have to keep learning. You never want to be that physician, that care provider that closes the textbook and never opens it again after graduation day, except to do your CME so you can just, get your credits and keep, renewing your licenses. I mean, I think if you do that, you're really setting yourself up for failure. And this is not the discipline or the profession you should go into. So you have to keep an open mind because roles are going to continue to shift. I could not have imagined years ago that I would be doing the kind of healthcare that I'm doing right now. In fact, I was just on a call just before our session here with a group of surgeons that happen to be informaticists. And one of the things that was said was, well, how do you balance being a surgeon and an informaticist? How do you balance being clinical and non-clinical? And it motivated me to speak up and say something because I remember my tension that I had when I was assuming the role of chief medical informatics officer. Because I was, at that time, I'm still clinically busy, but I was much busier than clinically. In my mind as a surgeon, right? My identity was a surgeon. And now I was going to take this informatics role, which at the time was a very important role because we were in the middle of adopting the MHS Genesis, go live, was being planned all over the entire globe. We were talking about workflows and waves and all of this stuff. So it was a lot of work to be done. And I knew that I'd be doing less clinical work. And, one of my senior informaticists, someone who had learned about informatics in the senior part of his career, stopped me and said, Hassan, you are still a clinician. You're just doing something in a different way. And your impact actually could be much more powerful in informatics than it can be in a surgical setting. Because in the surgical setting, you're going to operate on one patient, maybe a couple cases during the day or many cases during the day. But at the end of the day, it's just a few people. And over your lifetime, it may be thousands of people. But in informatics, and you think about our impact as a group of informaticists that were working about bringing together and bringing into existence this brand new electronic health record, which was going to impact the lives of millions of patients. Think about that impact. So my point is, stay curious. Your role will evolve and shift, and you have to absolutely continue to adapt, adopt, and learn. And I think that would be my sort of three tenets, adapt, adopt, and learn. Always learn and stay curious. I think that's what's going to happen. And at the end of the day, every specialty is going to be disrupted by AI in one way or another. Some of them are going to be disrupted a lot sooner and earlier, but at the end of the day, every discipline is going to be disrupted, much like the way electricity disrupted everything when it came to existence, over a century ago.
So it's funny that you mentioned Star Trek because, on the Enterprise, they've got a doctor. Bones is there. So,
That's right.
How, as AI becomes more embedded in medicine, how do you envision the role of human healthcare professionals evolving? Will we be collaborators, overseers? What will we be called? What's going to happen? And with all of this AI doing critical thinking, will the humans you lose some of that natural cognitive skills and abilities that we've kind of grown to rely on?
I don't think so. I think for those of us that go into healthcare, I think it's a certain kind of person that goes into healthcare. So my hope and my wish would be that those people that I've been working with all my career, those are very curious, very intellectually capable, very caring individuals, especially those that decide to serve. They're going to continue to be those kinds of individuals, and if that is the case, which I believe it will be, they're going to continue to adopt and evolve, and they're going to continue to learn. And I don't think that they're going to decline in any way. I think their ability to do more is going to be only enhanced with AI. You bringing up Star Trek again, for those sci-fi fans, and I'm one of them, there is a saying that I came across, which is so true, and it's the only difference between science fiction and reality is time. We're walking around with supercomputers in our pockets, right, in our palm of our hands. I have one right here, and I remember programming my Commodore 64. Now I'm really dating myself, and I spent hours and hours just to program this thing so I could play a little game. I'm walking around now with thousands of Commodore 64s right in my pocket. Not only is it a phone, it's a camera, it's a calendar, it's got all these different apps, it can do all these different things. The tricorder is not too far away. Trust me on that. So your question, which is really important, is what is the role of humans? I think we are going to evolve into what I like to call, especially for this audience, decision commanders. Decision commanders. We are going to be given more access to information to make better decisions. And at the end of the day, I think that is going to make us better physicians, better practitioners, and ideally be more effective in shaping and directing the outcomes of our patients that have entrusted their care to us. Decision commanders. Because you think about this, right? Even in the time that we've been sitting here, and I just read, another great paper from my discipline from the Journal of Heart and Lung Transplantation. Amazing study, great information, good outcomes, great data. That just happened to be something I read today because I happened to see it come into my feed. Every day there's something like that coming out. How can I keep up with that information? And I'm someone who tries to seek it out. There's no way we can do it. But with AI, you can, with the right prompt, with the right information, with the right query, or even without doing that, you can have systems in place where relevant information to your specialty, your discipline can be made available to you in a timely manner so that you see what's the most cutting edge, what's the most relevant, what's the most important, effective, and impactful information that you can apply in your practice real time. Now, that is incredible, especially when I think back to my time in medical school of going to the library and having to look through the stacks and find information, or, be lucky enough to find it through my librarian. I have access to all of this information now with a few keystrokes. If there's a tool that can bring me more information so I can make a better decision, then I want to be the decision commander. I don't want to do the scut work of looking for all this information, especially if it's coming to me from reliable and trusted sources. So I think our evolving role as practitioners are going to be, that of a decision commander. For those of us that are, doing procedures, I think our procedures are going to become enhanced. You imagine a scenario where you're doing laparoscopic surgery or robotic surgery, and you're deviating, from the place where you should be anatomically, and you get a little, buzz on the device that could prevent you from actually, harming something or injuring something that would have caused a problem or complication. I welcome that. Let me have that. It's like when you're driving and if you have one of those cars equipped with lane assist, you drift off a little bit and the car shakes and puts you back in the right place. You know what? That's probably a good thing. That's probably prevented some accidents, or probably has alerted someone to be a little bit more reactive or more responsive to their driving. So I think these are the kinds of things that are going to help us be better equipped to take better care of patients. And I think AI is going to drive a lot of that. So, and the short answer is evolving human roles is going to be, we're going to be decision commanders equipped with a lot more information and better information that we can apply at the bedside.
Now, I know that the Commodore 64 was more than 5 years ago. And at that time, when you're, programming it, you were not really thinking about an iPhone, 30
No.
years from then. But with the speed of AI, without a crystal ball, looking ahead 5 years, what would you predict is the most significant change that AI brings to healthcare, both in civilian and military environments?
Well, I think the most significant change that AI is going to bring to healthcare, and this is probably counterintuitive, it's probably not what many of my providers would answer, but this is what I answer just because I see this trend, is that patients are going to be more empowered in a way they've never been empowered before. Let me repeat that. Patients are going to be more empowered in a way that they've never been empowered before. And that, in the next 3 to 5 years, is going to fundamentally change the way that care is delivered in the United States and the rest of the world, for that matter. Why do I say that? Because if you think about how healthcare has evolved, this construct that we have right now was largely the result of a post-World War II era. If you think about Little House on the Prairie and what that doctor looked like when they would go out to see a patient and have their bag and they get paid in chickens or with a pie or something like that. And even before that, thousands of years before, the practice of healthcare was not as it is right now. It's become a very large industrial based, corporatized, private equity, all kinds of things. It's a big business now. That is poised to be upended because for many, many years, decades, patients had to come to a facility. They had to come see an expert to get information to make a decision on how they could take care of themselves. Well, with the advent of this same device that I talked about, they have access to information, really good information that has learned about them, that's continually tracking information about them, whether it be blood pressure, whether it be O2 sat, whether it be weight, whether it be what they ate, what they're not eating, how they sleep. They are now empowered with a myriad of information, a myriad of data that can help them make better decisions about their eating, about their lifestyle, about their habits, about their conditions. And because of telemedicine and if you think about telemonitoring, they are able to access expertise without leaving their home. Care can come to them. So the 5-year horizon, in my opinion, is that patients are now going to be more empowered. They're going to have greater access to information. They're going to know more about themselves, more than a clinician could ever know about them, because we don't have the ability at least traditionally, to know what's happening to a patient pretty much the 364 days of their life that they're out there living life, and we get to see them for a few minutes in the office. That is going to completely be upended and undermined in a way that hopefully will benefit the patient, I think. Now, it's going to be up to the healthcare organizations that are out there that are in need of seeing these patients and obviously monetizing their care to figure out how they can meet the patients where they are. Because if they don't do that, guess what's going to happen? This paradigm that was largely the construct of post-World War II, with corporations saying we'd offer healthcare as an incentive to bring in talent and to get the workforce that we can, help us achieve our goals and mission. That could be a different paradigm. It could be that patients now, go to another model where they feel like they're getting better care, at least primary care for sure, in a way that much more convenient, much more effective, and potentially cheaper for them. And I think that's going to be the biggest 5-year horizon change that we see: the empowerment of patients, the ability for them to make better decisions on their own, and the infiltration of non-traditional healthcare people helping patients with that aim and that goal, and monetizing it, and taking away from sort of large market share that traditional healthcare providers and organizations have had.
So besides some of those business things, what are some of the main hurdles getting us from now to 5 years from now? Technical, regulatory, you mentioned you're trying to figure out how do you change the business paradigm to make it work. But what are the hurdles standing in the way?
Interoperability debt, I think, is a big hurdle. What I mean by that is, going back to your question about, oh, we have proprietary data, like the Epics of the world kind of closing off, their echelon of information to, the Cerner systems of the world, even though we have these exchanges and things are only partially shared. I think that's going to be a problem. The fact that we still have legacy EHRs that don't always ubiquitously transfer information, I think that's going to be a hurdle. We're going to definitely have existent regulatory hurdles that are going to, continue to either be overcome, adapt, or change. And I think the FDA is trying to do some good work in this area, because they realize that they're dealing with a technology that doesn't fit their paradigm of sort of regulatory acceptance and approvals, because it's moving so fast. The software timeline is not moving like the medical device timeline or the drug development timeline. It's much, much faster. And probably the biggest hurdle to sort of realize this, if you will call it nirvana, or fundamental change, is probably going to be talent upskilling and just the adoption by our care providers and their patients. I think right now the conversation we're having, and for those that would be interested in it, are probably for those that are super curious or the early adopters. We're still there. Almost every audience that I speak to, with the exception of one, by the way, when I go and I say, hey, how many of you are using AI on a regular basis? Usually, Doug, it's about a third of the audience that that raises their hand. This is like a third. And I'm surprised, because most of my friends are like, they've been using it for years. And I recognize that that's representative and probably emblematic of a lot of the country right now. Maybe it's a little bit more than a third now. So if you think about the iPhone, when that first came out, not everybody had an iPhone. It was kind of novel. It was pretty expensive. It didn't really, kind of work really well for everyone. Now that's just like not even a factor anymore. Almost everyone has a smartphone right now. And then even going back even further, I like to use the example of those that were, using candles when electricity was coming into existence. And people were very nervous about electricity. They were like, well, I don't know. I don't trust that thing. I heard it causes fires, and you can get hurt, you can get burned, you can get electrocuted. I'm going to stick with the candles. And certainly for many years after electricity was pretty widespread, I'm sure people were still using candles and still using gas lamps and things like that. And eventually everyone kind of came around. Now we don't even think about electricity anymore. It's in the background. But when we lose it, best assured, everyone knows, hey, we've lost power. Everything is different. And I think that's kind of where we're at right now with AI. It's just this natural adoption curve that you see. There are the early adopters, there's lots of enthusiasm. It takes some time for there to be sort of widespread adoption. And then eventually you get the laggards and those people who are, really holding out till the very end to come on board as well. But in that process, there's this evolution, this arc of more progress. And I think that's been the case. You could probably draw a very similar kind of curve for the wheel, fire, electricity, the printing press, all of the above, right? These things have fundamentally changed humanity and the way that things are before and after their existence and sort of coming into fruition. Now, I'll qualify that for the purists out there to say, well, AI has been around for 50 plus years. Absolutely true. But it's the convergence of where we are right now that makes this time in AI a lot more powerful, meaningful, and I think a lot more impactful. And that is the fact that we have data in a way that we never had access to data before, much of it being digitized, right? That's a big difference. We have a lot of investments in AI right now and a technology that is very powerful and is exponentially getting better as we speak. And we have a lot of talent that's working in this space, developing models with a kind of almost laser like focus, kind of this arms race, as I mentioned before. Notwithstanding, people, people that are driving all of this, right? People wanting more, the ability to do more, the ability to be more productive, patients wanting to get better care and do it in a way that's more convenient than the way it is right now. Like, who wants to get in a car and drive to a facility that's not very friendly, drive around and try and find parking, walk almost a half a mile, if not longer, to get into an office, to sit there for a few minutes with other people that could potentially make them sick just to see somebody for a few minutes and have something done or prescribed or have an exchange that they could have done in the comfort of their home and have every resource available to them delivered virtually.
So kind of thinking about our audience of WarDocs, I would put us kind of on, maybe the leading edge of that curve of the early.
Oh, 100%. Yeah.
And I know that there's people who are listening right now are thinking, okay, I'm a doctor, I'm in training, I'm a nurse, I'm some other healthcare provider. What practically could I do tomorrow or the next couple days or weeks or months to get ready and prepare for AI? What's going to come? Do I need to do a fellowship in clinical informatics? What do I need to do?
Yeah, I mean, I certainly wouldn't discount that because I did that for sure, and I think it was very helpful. But not everyone's going to have the time, desire, or opportunity to do that, so that may not be practical for many people. But there are things that you can do, right? Data literacy, I think, is really important. Just understanding what the terms are, reading about AI, learning about AI. There's so many courses right now that are available to people, pretty much at a nominal, if not free cost or charge, where they can learn a lot about AI. And it could be very impactful and very helpful. I will say what they can do right now, though, Doug, and I always admonish and advise anyone in any audience that I speak to do this, is to start using AI. And if it's just, a dip in the, putting your toe in the water, to just use the large language models. And you can choose whatever you want. I won't even name the names, but there's so many of them, from ChatGPT to Perplexity to Claude, Gemini, Llama. There's all of these things, right? And I say that because that's the most simple and most tangible way to sort of appreciate what's happening. And you may use it and say, oh, this doesn't work for me, or I don't find any value. And I would say, don't stop, try another one, because each model has a little bit of a different nuance, a different approach, and they're pulling from slightly different information data sets that can give different responses to the answers. Why I would encourage everyone to do that is because you won't have this technology debt that I think is only going to accumulate the longer you hold out or say, you know what, I'm just not interested. I don't want to do this. I don't want to work with this. Because I think it puts you at a disadvantage, because others around you in your discipline and your specialty are going to be doing that. And, you've heard this probably cliche, oh, don't worry about AI replacing your job. Worry about, people using AI replacing your job. That's absolutely true, because you won't even know how your job can evolve into a better way if you haven't been using the tool. If you are, a carpenter and you have now just found out that they made this thing called a hammer, you'd be like, oh my gosh, this is the greatest thing ever. You could build a doghouse with it, or you could build a cathedral. But what if you never even found or never decided to use the hammer, and you were using a rock or something else? You'd just be left behind. The rest of your carpenter colleagues would just, over time get better and better. And as the hammer became the power saw, or the drill, or the whatever it is, you name the thing, you just stay with your rock, and you would be, you'd just be left behind. I think that's how we should look at this. AI is one of these ubiquitous general purpose technologies that's going to permeate and infiltrate every aspect of our lives. It already is and already has, and it's not going to stop. So this, I'm sad to say, is not one of the times where people will be right if they say this is a fad, it's going to pass, and they'll never have to worry about it again. This is not that. This is not that technology. And the AI you're using right now is the worst AI you'll ever use. So if you do anything at all after listening to this, I would say, be vigilant about your curiosity, learn about it as much as you can, take a course or a class, immerse yourself in some way in it. And at the very, very minimum, try using it. Start with something very simple. If it's just a chat bot or something like that. And if you don't like it, try something else, and just keep trying to use things and adopt these tools into your workflow until you find something that's actually helping you do your work better. And then I think once you realize and find that there's something that can help you do what you do better, you'll start to appreciate, oh, I get it now. I can see how I can use this to shape my practice. I can use this to take better care of my patients. I can use this to be, a better surgeon, a better clinician, a better ward doc. I can start thinking about how this tool could be applied to very significant problems that I see in my domain and space. And I can start working with engineers. I can start working with some technologists, so I can build these things myself, so that we can actually do things that are not possible right now in the future.
What advice would you give to people who are in a work environment that maybe the senior people aren't ready to put down the rock and pick up the hammer? What can you do to assuage some of the worries about AI? You got a bunch of young folks who are real excited about it, but the leadership saying, "Hey, hold your horses. We're using the rock."
Yeah. Anybody that's in that position needs to really take heed to it, right? And think, right? You don't want to do something that's going to, make your boss irate and cause you reputational, if not career harm, right? So you have to be very strategic in that space, and dare I say diplomatic. However, that's why I wanted to characterize our whole discussion with that framework right in the very beginning of thinking about this as an arms race. And I would say to that junior practitioner, or someone who happens to be in a domain or an environment where there is resistance from their leadership, to really characterize the time that we're living in that very, very, very important national security lens. Kind of use that as the beginning place of the discussion. And if necessary, even evoke how we got to where we are right now. That meaning United States. The United States position in the world was a result of the outcome of World War II, and that use of a very powerful technology at a time when everyone was trying to get that kind of technology, but we were first. And that's kind of where we are right now. And I think if you frame it in that way, particularly for senior leaders, especially in the military, I think they'll start to get it. I think they'll start to understand, because we all realize that our diplomacy, our information warfare, our certainly our military, and all of our economic, kind of strategic tools or levers that we use under that kind of dime construct is so effective in the world. Our diplomacy is very effective. Our information is very effective. Our military is very effective. And certainly our economic power is very effective, because we were the victors of an arms race a long time ago that unleashed a very powerful weapon on the world. And we're at this point right now where this very important technology is again holding in balance the power and the position of all the global, actors, if you will, right now, in a way that America is in my opinion, in a can't lose situation. Because if we do, we will potentially cede our position in the world to someone else. And AI is that kind of technology. And so if you start with that, maybe they won't be so upset if you're using a chatbot to help you do your work. I think that's really the reason why I thought it was so important to start with that characterization, because the stakes are much higher than, oh, I'm using AI to help me do my work a little bit better. I'm using AI to help me develop these PowerPoint slides a little bit slicker than I would otherwise. Let me use this hammer, because it's not just us using this hammer. It's absolutely giving us the ability to even use the hammer in the first place. Like, if we wouldn't even have the opportunity to use the hammer, if we don't adopt this, if we don't lead in this technology, it's that important right now.
We've been speaking with Dr. Hassan Tetteh on WarDocs. Hassan, thanks again for sharing your insights about artificial intelligence. I think this has been just a very fascinating conversation, and thank you for your service to this country.
Thank you, Doug. Thank you for the honor to visit with your audience, and I hope I've imparted some good advice. And I will also highlight, because of that last question, this posture of balancing the excitement with the caution. And for everyone listening, I think this is one of those times where strategic balance is really important, when it comes to AI. But again, keep in mind the context, the global geopolitical context of where we are in this time, this very critical time of AI, and what its power and what its potential can do. And I think the United States just needs to lead in that. And I think we are in perhaps the best position as WarDocs and the WarDocs community to really take up the shield and lead, be the vanguards. So
Yeah,
thank you for helping me share these thoughts, and I hope we've provoked some thought in individuals, and certainly welcome some robust question and dialogue to keep the conversation going.
Yeah, I mean, this is our 21st century Manhattan Project. So,
100%.
thank you for your insights. It's good to talk to you.
Yeah, pleasure.
Thank you for listening to WarDocs. We sure hope you enjoyed it. WarDocs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team WarDocs on wardocspodcast.com. Thank you for your support. If you like war stories and medical drama, WarDocs has you covered. Spread the word.